From ABC News headquarters in New York, this is World News Tonight. Still ahead on World News Tonight, an extreme treatment for extreme pain. Will surgery cure this woman of her crippling migraine?
Sounds incredible.
Now we turn to migraines. So painful the word itself nearly hurts. Almost 30 million Americans suffer from these headaches, and most of them are women, some of whom describe migraines as more excruciating than childbirth. ABC's Andrea Canning joins us now to tell us about some new treatment. It's drastic surgery.
Jim, certainly drastic for some people, but not for people who are desperate. There are many migraine medicines, but for a small group of sufferers, nothing works. They are always hoping the next breakthrough will be the one that brings them relief.
When 54-year-old Bonnie Muir gets hit with a migraine headache, life stops.
It's the worst headache you've ever had.
At times, dunking her head into a sink full of ice is the only way to numb the pain.
It feels like a 10-penny nail boring through your temple.
For 40 years, Muir has lived with as many as 4 migraines a week and the nausea that accompanies them.
You can't do anything. Sometimes the medication just doesn't work. There's a strong sense of being powerless and not being in control of your life.
So when Muir saw this article about a conventional nasal surgery now being used to help prevent migraines, she felt she had little to lose.
I had a headache Tuesday and Friday.
I hope this is the end of it, and by doing this procedure, I hope you will be headache-free for the rest of your life.
Dr. Faridun Behin, an ear, nose, and throat specialist in New Jersey, confirmed what he has found in other migraine patients, friction in the walls of the nasal cavity called contact points, which he believes can repeatedly trigger migraines.
People that are suffering from migraine, if they have contact point inside their nose, removing the contact point most probably will relieve them from the headache that they have.
But most leading migraine specialists are not convinced surgery is a cure.
I'm going to pull resist.
Bonnie Muir's neurologist, Dr. Larry Newman, says for some of these patients there are other triggers for migraine, including weather, diet, and in women, hormonal changes.
What I think it will do is it will make the headache much more treatment-friendly, so that the medications that I now try on Bonnie will work optimally. So I can give her an acute medication when she has the headache, and it'll go away in an hour, and she'll be good to go.
So far, Bonnie Muir is more than satisfied. She has had only 2 mild headaches in the 10 weeks since the surgery.
My life has tremendously changed from one that was centered on having to think about when you might get a headache to the point where I don't think about them at all anymore. I just have a sense of being free.
Bonnie Muir was obviously happy with the surgery, but Jim, only people who have these so-called contact points in their noses are eligible for this surgery.
And what does that mean? How many people is that?
Well, it's hard to believe, but we actually don't have the answer to that. No one really knows. And there's also no definitive proof that this surgery actually works, not until someone does a study which proves it's not just the placebo effect at work here. So this is a surgery that you really want to do your homework on.
Andrea Canning, thank you.